Waking up at age 4 in the hospital bed is my earliest memory. When I woke up, all I can remember was my family and hearing the words diabetes for the first time in my life. I was diagnosed with type 1 diabetes in 2000, and I've been living and adapting with it for 18 years now. There are two types of diabetes that men can get, being type 1 and type 2. Type 1 diabetes, the more dangerous of the two, is caused when the pancreas fails to produce insulin to the body, which regulates the body's sugars. But with type 2 diabetes is the most common form. If you have type 2 diabetes, your body does not use insulin properly. This is called insulin resistance. The CDC reports that over 30 million Americans have diabetes, almost 10% of the US population. It is also, as of 2015, the 7th leading cause of death in the US. Men with diabetes are at increased risk of serious health complications, including premature death, vision loss, heart disease, stroke, kidney failure, and amputation of toes, feet, or legs. For men with diabetes, there are several health risks that can occur. According to the Joslin Diabetes Center, diabetes is a leading cause of sexual health issues in people, along with hypertension, high cholesterol, and smoking. It can affect nerve function and blood flow to many places in the body. One area that can often be affected is the genitals. In men, this can commonly manifest as erectile dysfunction. Depending on how well the condition is being treated, men with poorly controlled sugars are more likely to have sexual issues. One of the bigger factors with sexual health in men is erectile dysfunction. Nerve and artery damage can disrupt blood flow, which causes erectile dysfunction. According to the American Diabetes Association, along with ED with diabetes, things like low testosterone and emotional health are also things that can be affected in men's health with diabetes. Either with type 1 or type 2, there are things that men can do that will greatly affect how living with diabetes can be. First, finding a healthcare provider that you can trust. I have been with my endocrinologist since I was 10. Finding a healthcare provider you like can help with the steps in treating diabetes. Next, increasing one's physical activity daily and better food options and moderation also can help adjust sugar numbers and keep a diabetic's average blood sugars at a good level. Diabetes is something that myself and many other men have to live with until a permanent solution can be found. But living with it will not control how I live. And many other men can live normal lives with knowing how to treat diabetes and having knowledge about the condition.